My name is Lieutenant Kevin McFarland, and this is my story with Galleri. Started out as a volunteer in 1995 in my hometown. Was part of a high school baseball team, was real successful, and they always took us through town on the trucks when we were done. So when I got in college, I felt like volunteering, and I just got hooked. And ever since then, I've been a part of the fire service with now 30 years total in service. My job as a firefighter requires physical fitness. You have to be in shape to do this job. So I've always been one to work out, to stay in shape. It helps you get through the injuries, helps you get through illness. There's nothing in my family history that had me concerned for cancer. There was 1 or 2 cases, but nothing that would have you worried about cancer or one that has plagued your family.
Everybody knows about cancer. If you catch it early, better outcomes. If you catch it late, outcomes are not good. There is a test now that has the ability to screen for multiple cancers. Having this test and the ability to screen for these cancers and potentially catch them at an early stage meant that our personnel would be treated sooner. They potentially have better outcomes, which allows them to have a better family life, a better quality of life. We have this test called Galleri available.
When we were offered the Galleri test at our fire department, I felt that any screening is a good screening. I was all for it. I wasn't worried. They made it so easy. The procedure itself is a blood draw. When I got my results, I received a phone call telling me that a cancer signal had been detected that is a prediction of esophageal cancer. No symptoms at all. I wasn't feeling bad. I wasn't having trouble swallowing, no heartburn, nothing.
He underwent an upper endoscopy, and the early stage esophageal cancer was detected. What's unique about Kevin's case is he presented at stage 1, did not require chemoradiation up front, and I was able to offer a minimally invasive esophagectomy to essentially remove his small tumor, and given his great prognosis, the impact of detecting this at an early stage opened the road for him to have a good chance at long-term survival.
He was smiles, and he was like, we got it. And when somebody just with confidence tells you we got it, it made me feel good. They were just excited to see something caught this early that they could treat. I've been on the other side of it, helping families and stuff throughout the years, but to be on this side of it really shows you the true brotherhood and family of the fire service. And by doing this test, I think I'm given more time. I don't know if I can go more into depth without getting emotional, but thank you.
Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origin. After diagnostic evaluation, around 40% of these people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended in individuals who are pregnant, 21 years old or younger, or undergoing active cancer treatment. Galleri does not detect a signal for all cancers and should be used in addition to routine cancer screening. False positive and false negative results do occur.